The detailed information for each patient in Compass is stored within a patient chart, and it's useful sometimes to access a patient chart to see the detailed anticoagulation history, message history, and other properties of the patient. There are two primary ways to access a patient chart. The first is to go to the INR view. In this case, we use a test patient. And whenever you see the patient's name, you'll notice that it's actually a link, that if you hover over it, that it will turn red. And if you then click it, you'll see that the patient chart then opens. And in the patient chart, there's a lot of information which we'll cover in subsequent videos. To close the patient chart, you simply click that X or this X, and the chart disappears. If you don't have a view of the patients handy, or you're having trouble finding the chart for some reason, you can click on Search Charts, Search Patients, and then select the patient's last name or first name, and then scroll down the list and click on the patient's name. And exactly the same as clicking a name from one of the views, the chart will open and will display additional information for you. We've seen before that on the INR view that you can establish a new patient by clicking the X. Another way of doing that is to search for the patients, and instead of opening the chart, say you want a new chart, and then it presents this view, which can be completed. When this is saved, a new chart will be automatically created and will be opened. Once a chart is opened, there is a lot of useful information that providers have access to, which can help them manage the patient. In this case, you'll see at the top of the screen is a summary of various settings. We'll talk about these later. Probably the most useful part of the open chart is the correlation of the patient's INR values with their warfarin dose. So in this top graph, you can see all of the patient's INR values. If you hover over them, you see the date and time and other details. Directly underneath that, and correlated with it, is the warfarin dose for the patient at these various levels. So as you can see just at a glance, this patient's INR values are changing. They went up and then they came back down again, but the warfarin dose stayed the same throughout that time history.